Now I'm quite proud to introduce our first postdoctoral fellow of the Center for Health and Nature since its creation. We've had enough support and funding to have been able to hire a postdoctoral fellow who is very dear to my heart. I've been accused of being a helicopter mom when it comes to my PhD students and postdoctoral fellows. So he's my child. Glad to introduce to you Omar Elsayed, our postdoctoral fellow in the center. He earned his medical degree at October 6 University in Egypt, and I confirmed that is the name of the university this morning, even with him. He is currently finishing his Master of Public Health at London School of Hygiene and Tropical Medicine in the UK, remotely, obviously. Before joining Houston Methodist, he served as a cardiovascular medicine resident at October 6 University in Egypt at the hospital. At the Center for Health and Nature, he's working on investigating the effect of the different environmental factors on both mental and physical health, with a special focus on cardiovascular outcomes. His other interests include identification of reliable prognostic factors to optimize decision-making and patient management. So help me welcome Omar.
Thank you a lot for this great introduction. I'm really glad to be here with all the great professors. So I'm Omar, postdoc at Center for Health and Nature at Methodist. And today I'm going to present the connection between health and nature and all the research updates we've made. Obviously, in this year that I have been a postdoc at the center. So I'm going to start with those are the main projects I have been working on for the last year. And by current projects, I mean most of them are like in the final stages, except the first one, which our biggest project, the trial we have been trying to push for, the nature pill. And that's the first one I'm going to start with. So the nature pill. So we have always been thinking that going in nature is something good, but there are some research there. But in this project, we have been trying to take this not just to the general population, but for the healthcare workers. How taking people out in nature can help them. We have heard of the first bathing, like going in nature for maybe 7 days or 10 days and immersing all your senses in the nature. But we believe this is a bit difficult for physicians or nurses or other healthcare workers working in very stressful situations. So we have thought of this trial of taking people out in nature for just 2 days over the weekend. So maybe they can de-stress and maybe avoid them from getting burned out. We have seen a lot of nurses quitting over the last 2 years from the burnout they had during caring for patients in the ICU or the emergency departments. So our hypothesis here is by spending time in nature, we can reduce the stress and the tendencies toward burnout. So we are planning to do this pilot project. We are taking 28 persons. 14 will just spend a usual weekend at home or whatever they want to do. And another 14 will take them in nature for 2 days. They will stay at AT Center. So in this place, they will stay at home. They'll be served food. They take walks in the nature. They go to the rockery. They can enjoy some night activities like fishing. So they are free to do whatever they want. As long as they stay in nature, they explore all the things. And the other 14 will just stay at home for the 14 for the weekend, and we will measure the effect. We had a lot actually of hypotheses and for the study design, like crossover design. So with this pilot study, uh, we decided, okay, maybe we can't do the crossover right now because we don't know how long will the effect last for the nature. So to do the crossover, we need to know what is the washout period. So in this pilot study, we are planning to do a lot of things. First, explore the washout period, how long the effect will last to do the crossover design. The other thing is explore the several measures we can use for stress, like maybe the vital signs, the physiological, the stress using the salivary cortisol. So we have a lot of measures. And of course, other than these objective, we have also other subjective like questionnaires, like the perceived stress scale test, the connectedness to nature, the generalized anxiety disorder, the 7 questions for stress and anxiety, and of course, the burnout scale, which is the MBI, burnout inventory questions. And we have been investigating also how we measure actually if people are really in nature by exploring a new application called the Nature Dose. I'm sure like Jared Henley will maybe hint on that later today. So we have a lot of measures to do. So people can enjoy some nighttime activities. I'm trying to keep the slides shorter because I'm sure after these great presentations before me, you are a bit tired. So I'll keep it very concise. So what are we doing right now is we already developed the whole protocol and we are pushing for the IRB approval. After that, we'll start the recruiting and hopefully we can start very soon. Moving out from taking people in nature, we wanted also to explore other areas like when people move from one place to another, they always think of the neighborhood they want to live in. Like, is it a rich, a poor? Does the neighborhood has good schools? Is it safe? But one of the measures we want to show is also the walkability. The walkability is measured using walk score, which is basically the how walkable is the area, how easy you can get around from your home to get several errands done, like maybe grocery shopping, uh, maybe going to the theater, a library, going to the park, so anything. So what we have done here, it's a cross-sectional study for the whole Houston Methodist patients in the whole HM system. This is with the collaboration with Dr. Nasser from the Heart Center at Houston Methodist. We have taken the whole 1 million patients, and because we have their addresses, we linked them using the walk score, and we hypothesized that individuals living in neighborhoods with higher walkability would have less cardiovascular risk factors like diabetes, hypertension, dyslipidemia, maybe even smoking. So this is a map for Houston, the whole Houston, and we can see actually how unwalkable is Houston. So only the high walkability areas is basically in the very center of Houston, mostly in the downtown, midtown. But other than that, we have 86% of the whole patients live in areas with walk score less than 50. We also have made this correlation with not just the walk score, but also the ADI, which represents the area deprivation index, which is like an index for the socioeconomic status. And we have found that there is like double risk or double burden. We have the least walkable neighborhoods also are the most deprived areas. And now, moving this easy pie chart, we can see that just moving from the lowest neighborhood walkability to the highest, the optimal cardiovascular health just increases. And by optimal cardiovascular health, I mean there is zero risk factors, no diabetes, no hypertension, no dyslipidemia, no smoking. So we can see that the higher walk score means higher prevalence of optimal cardiovascular risk. So this also a multivariable logistic regression. And in this variable, we adjusted for age, gender, race, and the socioeconomic status using the area deprivation index. And we get the same result in like half the risk for these areas by living in the highest walkability compared to the lowest walkability. So this project was presented at the American Heart Association last November, and we had amazing media outlet outreach. It was published in Forbes, the American Heart Association press release, Associated Press, and we received the data from the media outreach. It reached 140 million impressions or views on the different social media. Moving on from the physical health and the cardiovascular outcomes, now one of the interesting projects we are doing right now is for the mental health utilization in specifically urban areas. This study is very interesting, and I'll tell you why in a moment. So this cross-sectional study is using the Texas outpatient visits data. It's for whole Texas. And it included more than 55 million outpatient encounters in 751 neighborhoods. We had very limited neighborhoods from all Texas, which is like around 25%, because some data were not available using the walk score. So we also, again, measured the walk score against the mental health utilization. We limited our data to only the urban areas, and we hypothesized that higher walkability neighborhoods would have, again, lower mental health visits. Oh. We have 87 patients around Texas live in neighborhoods below 50 in the walk score. And just a quick stats here is we have found that the most walkable neighborhoods had the least median household income. They were the highest poverty and the highest insurance coverage. And I'm highlighting these three because in the next couple of slides, I want to discuss something, which is, to our surprise, we have found that higher walk score means higher mental health visits. So opposite to the previous study, that higher walk score or higher walkable neighborhoods, it means less cardiovascular risk factors. No, for the mental health, we have found exactly the opposite. So, but again, by visits here, we mean utilization. It's not just a visit or like a diagnosis, it's utilization. And again, when we did the multivariable regression, we have found the same results. So our hypothesis here right now, or we have found that these neighborhoods, which are the highest or the most walkable neighborhoods, also had the highest percentage of young people. And we have found that, and there is a recent meta-analysis and systematic review, they have found that actually anxiety and phobia onset for diagnosis starts from the age of 88 to 13. And again, for depression, bipolar, PTSD, the age of onset is below 35. So maybe that's the cause, because with these most walkable neighborhoods, we had the highest percentage of young people. Also, we have found that it has the highest education and highest employment and highest poverty. So this could mean like people just graduated and just moved to work. So they still have very minimal income. So they are not rich people. They have been working for several years. Especially, we know that these areas has very young population. And again, also it has the highest health insurance coverage, which means more access to health care. And of course, by more access to healthcare, this means if you have a problem, you will utilize more of the healthcare you have. So I'll just move again quickly. I don't want to bother you with a lot of details unless you have questions. So other projects we have are more of the climate change also affecting our nature. And the UN now is talking about sustainability goals, and how climate change is causing ocean acidification and damage to our coral reefs, biodiversity. So with Dr. Courtney Seuss, they have conducted this survey, and I had the chance to do some analysis on it. It's the nature-based vacation and coral reef tourism. This was a cross-sectional study, nationwide survey last year, and it aimed to examine the preferences for nature-based vacation, how people spend their time, and how this might affect their environmental beliefs and their choices for nature-based vacation. The total sample was over 1,600, and we specifically took people who had at least one vacation in the last 5 years. And we have found that 55% of participants actually spent less than 3 hours a week in nature. Yet, 43% when they chose to go on vacation, they actually spent at least 6 hours in nature per week. And more than 80% agree that spending time in nature is very important to them while they are on vacation. And 52 only consider taking nature-based vacation. So about half of them only go for nature-based vacation. However, they spend less than 3 hours a week in nature in their normal life. So right now we are just finalizing the final data, and hopefully we'll start writing it very soon enough. Our last project is for, again, the whole environmental health and cardiovascular outcomes, which is heavy metals and cardiovascular diseases. This is a systematic review for all epidemiological studies out there, because we have noticed there are some heavy metals that have been never had a systematic review and had some conflict in the results. So in this systematic review, we have focused mainly on lead and cadmium. Other heavy metals we have found there are very strong evidence right there. And we specified the outcomes as coronary artery disease, peripheral artery disease, and heart failure. Others, like stroke, it's very well established. There is very strong evidence there that there is a very good relationship between lead, cadmium, and, for example, stroke. So right now we have registered our protocol in Prospero database. We have searched 7 databases with around 7,000 potential articles. We already done the title, abstract, and full text screening. And now we have 35 eligible studies, and we are now in the stage of data extraction. So yeah, and we're doing the quality assessment, of course. So after that, after the data extraction, based on this, we'll see how many outcomes we can work on doing quantitative analysis, the meta-analysis, or just qualitative review. So for the future projects, we have actually a lot going on. I'll just give you like 3 examples. We have some like the nature score. This is one of the very good exposures that we need to investigate for the several health outcomes, cardiovascular, mental, respiratory, a lot of things. And of course, one of the projects that also with Dr. Nasser, he wants to explore is then walkability and just obesity. We want to see what is the incidence of obesity. We have data for patients over 5 years. So what we have done before is basically cross-sectional. But now, what about over time, people living there for a specific period of time? So maybe are they getting fatter or leaner? So we want to explore this. And of course, for other environmental exposures like the particulate matter, the 2.5, the ozone, there are a lot of things. We can explore it with the cardiovascular outcomes and mental health outcomes as well. So after this, I want to thank all the great professors I have been working with. Dr. Jay Maddock, Ira Cash, Robert Jackson, and Dr. Nasser. He's not here today. And of course, I want to thank all the sponsors and donors for like all the projects we have been doing. And lastly, you are welcome in Egypt anytime, but please don't go there in summer. It's super hot. Thank you.